Tonight,
Clear
on
out of
St.
the way
Elsewhere.
here, please. All right, we got a full arrest here.
Code, somebody!
Well, we're flattered you've come all the way from Hungary to visit us.
Very proud to meet you.
Dr. Craig hasn't yelled at us yet.
Who says I yell? Smooth, wasn't she? Very smooth.
Dr. Chandler, I want to thank you for trying.
Stan, it's the wrong plan.
I need money. In fact, I'm worth more dead than I am alive.
Now, I can't help your husband if I don't know what's going on.
Life has dealt us both a bad card, but you have many more left in the deck, and it's only a fool who wouldn't play out his hand.
You give your patients the wrong antibiotics. You don't know what medications they're on. You write the worst progress notes. You're pathetic.
It's the last time I volunteer for ER duty.
Oh, Wendy, this is fun. Get off of me!
Careful!
You know, normally I wouldn't do this, but if you twist my arm, I'll let you stay here and take care of him.
It's all right by me. Some foreign surgeon is supposed to be visiting. I know that Craig is going to be dosing out the discipline.
Let go of my hand, man! Let go of my hand! Why don't you just bring him down here? This is the perfect place to serve the tender and sensitive care that has made American medicine famous throughout the world.
Okay, hold him. Hold him.
What's this guy been drinking anyway?
I'll keep Rothschild. It's hard for me to tell once he vomits. Spoils the bouquet.
Okay. Just a second. Here we go. Okay,
Swallow,
now it's in.
swallow.
It's in. Okay.
Swallow. Swallow.
Let me get it down. Just a second. We're hung up. Wait a second. He's got my hair. Somebody get him. He's really got my hair. Spoiled my cloth. How about some tape? There's a tape. Hold him right there. Let me hold this.
Go get it. Go get it.
And we got the tape. Now. Okay. Get it.
Syringe.
Syringe. That's none of that. Okay. We're in. Fine.
Sam, what happened?
I don't know. I guess my liver's acting up again.
I can see that. What happened to your appointment? Well, you were supposed to come in and visit me at the outpatient clinic, right?
Yeah, well, you know, I never been sick a day in my life, and when this hepatitis hit me, I guess I'm just not used to going to see the doctor.
I know. I understand. Nobody likes going to the doctor. When something's wrong, you have to come in so we can take care of you.
All right, so here I am.
Well, Stan, you should have been here 3 months ago. When did you start turning yellow this time?
About 3 or 4 days ago. What are you talking about? She don't know.
All right.
Look, I don't want you to get the wrong idea. See, I've been taking care of myself. I've been paying attention. It's just that, well, I got laid off and I lost my coverage. Nothing personal against you. It's just...
No, I don't take it personally. I just want to give you the best care I can so that you get better. That's all. And to do that, I need your cooperation.
Well, you got it.
Well, good. I'll be back.
I'll be here.
I'm very glad that your hotel is comfortable.
Oh, it's really more than comfortable. It is fancy.
You know there's a Hungarian restaurant just across the street?
Come on. I didn't come to America to eat Hungarian food. I paid a taxi and I went to Golden Arches.
You're kidding.
Why not? You eat goulash, don't you? Yoy, my hamburger. It was something fantastic.
What? Oh, you're here already.
Thank you.
Dr. Vera Anya, Dr. Mark Craig. How do you do?
I'm very good. Very proud to meet you.
Well, we're flattered you've come all the way from Hungary to visit us. Was I late?
Well, perhaps I was early.
We've been discussing your favorite subject, Mark, international cuisine.
Oh, really?
And Dr. Anya was telling me how much she appreciated the American hamburger.
Oh, among other things.
Well, that's very nice. Well, I thought maybe you could show Dr. Anya around, and then maybe we can meet later for lunch. Absolutely, whatever the doctor would like.
That would be fine.
All right, let's go then. Hamburgers must be brutal over there.
Who's next?
Cubicle 3. Here's Rutger's blood gas.
Okay, I already took a look at it. Do we have a bed?
427.
Okay, I'll just go talk to the family. They're in the waiting room.
Wife and son.
Is the Runiger family here?
I'm Mrs. Runiger.
Joe, doctor.
I'm Dr. Chandler. I examined your husband. He does appear to have a blood clot in his leg. We're going to send him upstairs, give him some blood-thinning medicine. Hopefully that'll prevent any more clots from forming.
I see. I see.
Let me ask you, has Mr. Runiger seemed, more confused lately, or...
Well, perhaps a little, but he's been slowly getting more and more confused, so it's hard to tell.
And when did they find the prostate cancer?
Oh, was it 6 or 8 years ago? It was when they did the surgery. My son's parking the car. He would know better.
Well, that's not important just this second. Your husband's going to be going up to room 427. It's on the 4th floor.
Thank you, Doctor. I'm going to wait for my son.
Okay, thank you.
Thank you.
Say, excuse me, are you a doctor?
It's like you brought got his own personal pharmacy.
Something happened?
Yeah, something happened. Seems like Myra and Tim Potts is eating me up, man. She doesn't even answer her phone anymore. I keep thinking she's with him all the time. This is bad.
Well, I wish I knew which party.
But she's my wife. She's out with somebody else. What would you do if Nina went out with somebody else?
Come on.
No, that's a score, ain't it? My wife's out with somebody else, period.
Well, what do you expect? I mean, she's probably lonely. She's got 2 small kids to take care of. She's trying to go to grad school. She's taking care of an apartment, and her husband is living with somebody else.
I want you to do me a favor. I want you to find out from Nina exactly what's going on with her and Tim.
Why don't you ask her?
Because she won't tell me what she'll tell you. I want to know exactly what's going on. I want to know exactly what's going on. I want to know everything that's going on.
Just listen to yourself. You're asking me to manipulate my wife. I mean, that's ridiculous.
Fine.
Peter, you're acting childish.
I don't need you to tell me what I'm doing.
Peter. Peter. Come on, Scotty. You and Fiscus ever get to see the real Ann Sucker?
Nope, next Sunday.
Mr. Runiger, we're going to take you up to room 427. Mr. Runiger? Mr. Runiger?
Oh, hell, he's not breathing.
No, wait, don't do that. Push the next floor.
1 and 2 and 3 and 4 and 5. 1 and 2 and 3 and 4 and 5. 1 and 2 and 3 and 4 and 5.
Okay, come on, let's get him out of here.
Clear out of the way here, please. All right, we got a full arrest. Come on, let's clear out.
Let's go. Let's get him on the floor right here. Come on, take it easy. Nice and easy. Get the feet there, please. Very loud. All right? Let's go. Come on.
1 and 2 and 3 and 4 and 5. 1 and 2.
Come on, can we get a crash car, damn it?
1 and 2 and 3.
Okay, I want an Ampabep, a bicar, an ET2, then a curve plane. Let's go.
Hold it still. Hold it still.
1 and 2 and 3.
Still. Hold it still.
2, 3, 4.
Okay, give me the paddles.
2.
Come on, please. Hold that back for me, please, Shirley. Okay, clear. Clear.
It's flatlined.
Is that it?
1 second. Excuse me, girls. Voila.
How do you expect me to carry all this?
Oh, I'm sure one of your colleagues would help you. I'm sure one of them would.
Oh, come on. You're both big, strong, healthy girls. Here, come on, give a guy a hand.
Lucky for me, Mr. Halper needs his enema. I'm out of here.
You're lucky I respect older women.
Okay, you caught me at a weak moment. Where do you want them?
What do you think? By the piano?
Whose are these, anyway?
They're all Runigers. I just thought I'd do a discharge somewhere.
What do you need all these old charts for? He was barely admitted.
I just thought I'd flip through 'em.
I wouldn't even look through old charts for stuff like that.
Well, I gotta write something.
I'll tell you what to write. Reason for admission, patient dying, hospital course, patient died, follow-up plans, relatives to visit gravesite at regular intervals, flowers, PRN.
Final diagnosis, TRO.
What's that stand for?
Time ran out.
TRO. I don't think that was a diagnosis when I was a resident.
Excuse me, I gotta check on a patient.
So, what happened with Mr. Runiger?
I'm not sure.
Excuse me.
You must have done something to him, Philip. It's obvious he was in perfect health when he checked in this morning.
I'm really sorry.
All right.
I don't know. He had a blood clot in his calf, maybe through an embolus. He was fine in ER. As soon as we put him in the elevator, he coded.
Did he complain of any pain or shortness of breath?
Nothing. Evidently, he'd been going downhill mentally for some time.
Has someone told his family?
Yes, Nurse Rosenthal. Oh, Dr. Lepsing is the family physician. I just thought I'd wait to reach him before filling them in on the final details.
Okay, well, I'll talk to them.
Oh, you mind if I come?
No, not at all. I'll page you. Think an autopsy would be helpful?
Well, it would be nice. I mean, he had enough things wrong with him. Besides, I'd like to see if I missed something unusual.
Like a little TRO tattooed on his heart, maybe? I'll see you later.
Excuse me, Dr. Auslander. Can I ask you a quick question?
You can ask me a long one if you like.
I've got a patient, Stan Morgan. He's a 38-year-old white male, no serious illnesses except for hepatitis B, which he had about 6 months ago. We saw him once as an outpatient, and his liver enzymes were improving.
Did you schedule a follow-up to see if he still had antigen positive?
Yeah, but he didn't show up. And now he's back with terrific jaundice.
What do you think he has?
Well, his labs are still pending, but I don't think it's his gallbladder. At least not by my exam. What I'm wondering is whether he's got chronic active hepatitis and whether we should give him some steroids.
Well, don't be in such a hurry. Is he a drinker?
I don't think so.
You know what I mean by a drinker?
Yeah? Someone who abuses alcohol.
Someone who drinks more than I do.
Well, he's actually a pretty straight guy. You know, he worked nights to support his family.
Well, he could have chronic active hepatitis. But I wouldn't put him on steroids until I had a piece of tissue to look at, and I'd wait for his labs to come back before I'd go rushing into his room with a big biopsy needle.
That's what I wanted to know. Thanks a lot.
Anytime. How old did you say this fellow was?
38.
Shame. Shame.
So you began your work on valve replacements before you got to Budapest?
Oh, yes, in Debrecen. The hospital is very good.
Oh?
But now I'm chief of cardiac surgery, so I must go to Budapest. Then in 4 years, there is a new chief, so I can go back.
It must be terrible living in a police state where they dictate your every move.
Oh, it's not so bad. You know, when you're a chief, you can take a trip like this, you can do research.
Even so.
Are you still interested in research?
Interested, of course, but I'm busy here. I still maintain an affiliation with the lab at medical school, but I don't have any time.
Oh, that's too bad. I very much enjoyed your work in congenital heart disease.
God, did you read that?
Yes, of course. It was a suggested reading during my training.
No kidding.
You must have been very young when you did that publication, yes?
Well, not that young. I just finished my residency.
Oh. Then you age very well.
Thank you. I try to stay in shape.
Cardiology.
Here.
I want to find out how things have been going at home since the last time you were here.
Not real good. Stan losing his night janitor job at the high school came on real sudden, and it's been kind of tough.
Has he been drinking?
No. Not as far as I know. He never was much for drinking.
Any chance he's been using drugs?
Oh, no, that's not him at all. I've never even seen him smoke a cigarette.
No, I didn't think so.
His liver's real bad, isn't it?
Well, I'm not sure yet. It could be.
You know, it says in here that if you put clay on your skin, it helps to soak up the poisons from the body, which makes it easier on the liver. I guess that's all a bunch of junk.
Well, unless they know more than we do.
Oh, no. No, I know you're all real good doctors here. And whatever you say is good enough for me. I'm just really glad that Stan's here now. And I really appreciate everything you're doing for him.
We'll do the best we can.
You can buy a car, but it's extremely expensive. But if you do the right things, the government will give you a car. Like when you finish what you call here the residency, yes? They give you a car. A small car, not like a Mercedes, okay?
Amazing, isn't it?
At least Runniger was nice enough to code early in the morning. I mean, I always get the ones who wait until I've done all their paperwork or until the cafeteria is closing.
No consideration.
That's right, none whatsoever.
They're paging you.
Oh, you're right. Hey, listen, I'm on call tonight, but tomorrow, why don't you code in a few more patients on my service, then I get half a day off.
Maybe you ought to answer that.
Maybe I ought to.
That guy. Don't be so sensitive, Phil. You knew Runniger was going home in a box. I don't know. Till this morning, I only had 3 codes that didn't make it this year.
Phil, I mean, with old charts this thick, the guy had to have one foot in before he got here.
Yeah, I guess you're right. Just seems strange, though, in an elevator. Take it from me, anything can happen in an elevator. Anything.
What, are you bragging?
No, just quoting a study I did.
You see, in the United States, doctors are very, big, important. In Hungary, doctors are not so important. Scientists, oh, they are important. So my husband, who is a chemical engineer, he got a car. He was only 23, very young. That is very impressive. You know, to have a car when you're 23, you are like a big shot, you know.
Is that why you went out with him?
Oh, well, of course. You cannot go anywhere without a car.
See, you're still driving the same car.
Oh, no. But they do insist that you drive the car until it falls apart.
Same with our residents, you know. Now, that's because they can't afford to buy a new one.
That's right. In America, you work for everything you get.
You're very tough.
Dr. Craig's philosophy is this. The only problem with being on call every other night is that you miss half the interesting cases.
Well, then I'm going to be afraid in the operating room today.
Surgeons in training don't need to be pampered. They need food and laundry.
Hey, what's a nice girl like you doing in a place like this?
Hi there.
Where are you going?
Up to payroll. They messed up my hours again.
I wish I got paid by the hour. I got an operator out there must be high on amphetamines the way she's been beating me. Then I gotta go see this guy on the floor, and when I get back, I got 2 new admits waiting for me in ER. It's gonna be a fun night tonight, I can tell you.
I wish I could do something.
Why don't you come on with me when I go see this guy?
Well, Peter, I gotta go down.
Come on. Now, just so we can talk a little bit here.
Who do you have to go see?
Guy down in 3325.
What's wrong?
He's dead. I just gotta pronounce him. All right, who's dead? He is.
Excuse me. Peter, you really shouldn't talk to patients like that.
You're right. I shouldn't. I want you to do me a little favor. On your way to payroll, I want you to stop by the pharmacy and get this filled for me.
It's got my name on it.
It's just value. I'm under a lot of stress lately. If anybody should understand that, it should be you.
I don't know about this.
I do. I'm the doctor. Come on.
Hello. Dr. Westfall, Director of Medicine.
This is Verniger, Doctor.
How do you do?
Albert Broniger.
Sir. You've already met Dr. Chandler, I believe?
Oh, how do you do, Doctor? Were you the one on the elevator?
That's right.
Isn't that something? He never even got to his room. He always was an impatient man.
Well, you know he was very sick.
Oh, yes. This last year was just terrible for him. You know what, with the cancer and the emphysema and the radiation treatment, I don't blame him one bit.
What happened in the elevator?
Well, nothing unusual. He just became unresponsive.
He had what we refer to as a complete arrest. In other words, both his heart and lungs stopped functioning.
Oh, I see. Is that very painful?
No. What happens is that the blood supply to the brain is suddenly cut off. There's really no feeling at all.
Oh, I'm glad of that. He's had his share of pain.
What causes something like that?
Well, there are many causes. He had a blood clot in his leg, and sometimes they can they can break off and travel through the body. But in a patient with as many problems as Mr. Roniger had, it's very difficult to tell. And that's why I think it's very important for the doctors and the other patients if we can have your permission to perform an autopsy.
Well?
Mrs. Roniger, to tell you the truth, I think you'd feel a lot better knowing exactly why your husband died.
Should we talk to Marie?
Yes.
I have a sister we've been trying to reach in Providence, and I'd like to talk to her first.
Certainly. I'll be in my office all day. You can call me when you decide, all right?
Okay. And thank you very much.
Thank you, Doctor.
I only wish we could do more.
Thank you. And you, Dr. Chandler, I want to thank you for trying.
Pulmonary conference is this way.
I know. Save me a seat.
What can I do for you, Sugar?
I need some results. Morgan, Stan.
You got a number?
234575.
So, how's life been treating you?
No, not bad. No complaints. Just a little hungry.
Well, have some. It's no good.
Now wait. I'll get something when I get home.
Yeah, I bet you will.
Dolores.
Okay. Now, what do you want to see?
What do I need? Protime, PTT, and platelet count.
Nope, still pending. The last I got on here is blood alcohol.
Blood alcohol? You sure you got the right patient? It's Morgen.
Yeah, that's it. Stanley. Morgen. They drew it last night in the ER. Well, you want it?
Yeah.
Looks like Mr. Morgan was partying, huh?
Yep. Yeah, I guess so. Thanks.
Don't mention it.
Clam. Meds to Dr. Ehrlich. Spread here and cut. Good. Very good. Saw. How's the ventilation?
There's no evidence of an air leak.
Okay. Now hold this. You know, Dr. Craig said something very funny today. He said the problem with being on call every other night is that you miss half the interesting cases. You want to cut here, please? You look tired, Dr. Ehrlich. Were you here with the interesting cases last night?
Yes, sir. Ma'am. Doctor.
Well, I'm tired too. But we must be good surgeons even when we're tired. Because Dr. Craig hasn't yelled at us yet.
I don't yell. Who says I yell? I instruct.
Are you absolutely sure that your husband has not been drinking?
What do you mean?
The blood they drew shows that when he came into the emergency room, he was legally drunk. Now, I can't help your husband if I don't know what's going on.
Well, I tried to stop him. But I can't. I can't. He doesn't even look for work anymore. He just drinks. See, he's hoping that his liver and all will kill him, and then we'll get the insurance money. But I don't want it. I don't want it. He only came in because a friend told him that if he didn't see a doctor, then we couldn't get the insurance money. God.
Okay.
But
Take it easy.
please don't say anything. I don't want him to get in trouble, please.
Don't worry. You won't get in trouble.
I just want him to get better.
I know you do. Okay, I know you do.
Please.
I'll come back and I'll talk to him later, okay?
Yeah. Okay.
Hey. Hello. What's his first name?
Edward.
Edward. Ed.
Here's the pericardial tray. Did you get the consent?
Yeah. Ed, you have some blood compressing your heart. I'm gonna put a needle in and drain it out, okay? I'll take that as a yeah.
So there's my doctor.
He's coming.
Darling, you told me that 20 minutes ago.
I beeped him. That's all I can do. There.
Who are you?
I'll be right back. I'm not exactly in the mood for another patient right now. I'm beat. What do you got? Huh? Hey, look, just because you made a mistake with a patient this morning, don't be carrying that around on your shoulders like that's the last mistake you're gonna
Look,
make.
you don't know anything about the case, all right? You don't know anything about anything, so why don't you just shut the hell up?
Hey, why don't you take it easy?
No, you take it easy. You take it easy. You know, you're in no position to make any remarks about anything around here because you don't know anything.
Dr. Chandler.
You give your patients the wrong antibiotics. You don't know what medications they're on. You write the worst progress notes. You're pathetic. Pathetic!
Phil!
What?
Dr. Morey needs you right away.
I'm sorry.
Whoa.
Let me tell you something. If it wasn't for some of the residents around here covering for your mistakes, you would have been gone months ago. So just shut up.
Are you my doctor?
Yeah, I'm your doctor.
Visiting hours are over. Visiting hours are now over.
Well, I'm angry with you for lying to me, but I still want to help.
Big deal.
It is a big deal. You could die.
Well, that was the plan.
Stan, it's the wrong plan. It's not fair to you, and it's not fair to your family.
What the hell do you know about unfair? I spent 7.5 years in that damn high school. Mopping floors, wiping toilets. So some fat cat politician come by and phase it out? So that you can put more taxpayers' money in his pocket? That's what I call unfair.
All right, well, it sounds like you got a raw deal there, and there's nothing I can do about
You're
that.
damn right. So don't come in here with some stupid doctor speech. Because I'm not a baby. I don't need pet dogs. I need money. In fact, I'm worth more dead than I am alive.
No, the fact is the insurance companies won't pay if you commit suicide, and that's what you're doing by drinking. If you think your family's hurting now, what do you think it's going to be like for them without you? I mean, Kay would clean floors and toilets for 100 years if she thought it would help you get any better.
Are you through, Doctor?
Yeah. Yeah, I'm through.
Oh, I'm sorry. I didn't know you were still here. We just came to say goodbye with you.
It's okay, I'm finished.
Go say goodnight to Daddy.
He's very stubborn.
I know.
I'll talk to him some more tomorrow.
So, Ehrlich, what do you think?
Sir?
Smooth, wasn't she? Very smooth. And efficient. My God, that was one of the quickest mitral valve replacements I have ever seen, especially considering how corroded the valve was. So, what do you think?
Oh, yeah, it was corroded, all right.
No, the tie, Ehrlich. Is it straight? This place is lit like a dungeon.
Yes, it's straight.
Good. Never trust a surgeon with a crooked tie. Oh, well. You dress almost as quickly as you operate. You know, if I may say so, that was an excellent procedure today. Just excellent.
Thank you.
Very impressive.
Well, it's good to have a compliment from such a great surgeon.
I'm just afraid that we won't have very much to teach you here.
Actually, I'm a little disappointed. You know, at first I thought perhaps we could do an annuloplasty instead of replacing the valve. But there was so much distraction.
Oh, absolutely. The only way to go. Can I buy you a drink?
A drink? Only one?
Well, whatever.
Of course. I cannot refuse as chief of surgery, can I?
Well, that's good to hear.
Dr. Auslander, have you by any chance seen Dr. Meyer or Dr. Rowe?
No, I haven't.
I've got to find somebody to take call for me tonight.
Don't look at me. Even though it's been 42 years since I've had to do it, I still don't have nostalgia from being a resident on call.
Me either.
Dr. Morrison?
Mm-hmm.
What'd you decide to do about that Norman fellow?
Would you believe it? He's been boozing it up.
Oh. That might explain things.
In fact, he tried to kill himself with it so his family can get the life insurance. He got laid off a few months ago. Decided to drink himself to death, put an end to it.
Do you suppose his outlook would change if we stuck that biopsy needle someplace other than his liver?
I don't think so. He's a pretty stubborn guy.
I assume you've tried talking to him.
Yeah, and I don't think he's feeling too hot about doctors right now.
Perhaps that's due to your nice, youthful head of hair. You know, by the time I was your age, my hairline had a certain, shall we say, distinctiveness to it, which I never hesitated to use in manipulating patients.
Mm-hmm. Well, I think I'm going to have to do without that particular attribute.
You never know. No.
Want to see me?
Yeah. Go on in, Phil.
Sam Hendricks. He works for the law firm that represents St. Alicia's. Dr. Chandler.
How do you do?
Yes, nice to meet you, Dr. Chandler.
My pleasure.
Sit down, Phil. The reason I called you in is we have a problem with the Runniger family. I got a message this afternoon that they brought in an outside pathologist. They want the body transferred for examination. And I tried to contact him to find out what the problem was. I finally reached the son, and he told me that their family attorney had advised them to pursue legal action.
What?
They're filing charges against the hospital and the doctors involved. Anyway, Sam felt that the three of us should meet.
Yes, now what I want you to do is write down everything you did from the moment you first met Mr. Runniger until he expired. And don't duplicate what's on the chart. We have a copy of that. Now, what I'm talking about, for example, is this. I mean, something you noticed about the patient but didn't write down. Anything unusual that might have been going on around you when you examined him. Something you might have said to another physician or the family. That kind of thing, you know.
How specific do you want me to be?
As specific as possible. If you remember the time you said something, or somebody was wearing something unusual, just write it down. Put it all in there. All right? Do you have any questions?
No.
Okay. Now, I know this may be frightening to you, but, well, there's no need to be frightened. At least not till I tell you to be. Now, it may sound strange, but, actually, I think you're lucky in a way. Because you're going to have an experience that every doctor in training ought to have. Because the way things are today, sooner or later, whether they like it or not, every doctor is going to go through this.
You know, in the good old days, when medicine was a gentlemanly profession, people didn't sue their doctor. Nowadays, they're awarding all these huge judgments. The legal climate is
fertile. There's a word for you. So, no matter what happens with this whole thing, you just pay attention. Because you won't find it in any book. I'll be in touch.
Oh, here, let me get that for you.
Thank you. Dr. Chandler, let my office know when you'll be available. Next time you do all the talking.
Thank you, Sam. He's something, isn't he?
Yeah, I'll say. What happened to his legs?
I don't really know. I think it was a car accident when he was young. But believe me, I've seen him in court. He needs nobody's sympathy.
Yeah, well, I'm glad he's on our side. You know, the family seems so reasonable when we talk to them.
Yeah, I thought so, too. But I guess when people are about to sue you, they don't telegraph their punches, right?
Yeah, but they knew he was sick.
Yeah, they knew it after he died. But I think you'd be surprised, Phil. Sometimes the people who are closest to a situation have the least amount of insight into it. Especially when it means they're going to have to recognize something they don't want to see.
I never expected anything like this.
I don't think we ever do.
This is your mother. Will there be anything else?
Coffee?
No, please.
More wine? No thanks. L'addition, s'il vous plaît.
L'addition, oui. You sure you don't want more?
No, really. Really, I'm going to get drunk. That's not very good for a visiting surgeon.
Listen, I know a surgeon who did his best work when he was drunk. That's the truth. Ed Tinsdale, one of my father's contemporaries, could do the most beautiful gallbladder, completely inebriated. I'll never forget it. It was one Sunday. My father and I just come back from fishing. I was home from medical school, and the hospital called to notify him of an emergency. And at that, my dad cut himself with the fish knife.
With your hand.
Yes. Anyway, he said, well, let's call Dr. Tinsdale. So I went to see the surgery, and when Tinsdale walked into the operating room, he smelled like a brewery. I mean, there was no doubt about it. He was drunk. And he proceeded to do the cleanest cholecystectomy that I had ever seen. And afterwards, the anesthesiologist said that this is the first case he's ever had where the surgeon was more anesthetized than the patient. Yeah, you know, funny thing about Ed Tinsdale, he went downhill after that. Okay, thank you.
Thank you.
Oh, listen,
That was very nice of you.
my pleasure, really. Oh, what the hell. Listen, do you mind if we stop by at the hospital before we get back? I have some notes that I want to check for tomorrow morning's conference.
No, of course not. Well, perhaps we're drunk enough to remove someone's gallbladder.
Good night.
Mr. Morgan?
Yeah?
I'm Dr. Auslander. I'm a liver specialist.
That's so.
I was talking to Dr. Morrison earlier today. Tell me about all the drinking you've been doing.
Look, I don't need another doctor coming in here and tell me what to do with my life. I got a family I can't feed. So don't come in here with your fancy suit and your tie and tell me how I'm supposed to feel.
Let me tell you something. Underneath this fancy suit and tie and shirt, there's a tube. One end of it is stuck in my liver, where a cancer is eating its way through my body. Now, the medicine I get through this tube has less than 1 chance in 5 of helping me live longer. It makes me sick, nauseous, and susceptible to infection. But I take it, and I take it with only 1 chance in 1,000, because that's how precious life is. Now, next year, if I'm still around, I will have been married 46 years. And it's absolutely true. It does get better all the time. And I've had the chance to watch my children grow into people that I not only love, but also admire. And that's a feeling you just can't put a price on. Now, I know I'm going to die soon, and there isn't anything anyone can do about it. But I'd give everything I own if I could have just one more day, one more minute to enjoy everything my family has meant to me. And that's why I know that what you're doing to yourself is absolutely wrong.
Yeah, it's easy for you to say. But I bet if you died 20 years ago, you'd have still lived a better life than I ever will.
a bad card. But you have many more left in the deck. And it's only a fool who wouldn't play out his hand.
Oh, I'm so beat. I'm whipped. They whipped me today.
Well, what are you waiting for?
Oberheimer's 10 o'clock labs.
Well, can't you take them over the phone?
Not if they've been operated on today. Herr Craig says we must stay for the labs and we must enjoy it. What must I have been in my previous lifetime to deserve this, huh?
A heart surgeon.
Gentlemen, nice case today, wasn't it, Coach?
Which one?
What do you mean, which one? Dr. Anya.
Oh, yes, nice. Very nice. Excellent.
Right, excellent. Ehrlich, you look ghastly. You should take better care of yourself. And then you have the Hungarians thinking I'm running some sort of slave camp around here. Sleep a little extra in the morning, okay? Dr. Anya and I will do rounds. See you, 10 o'clock, Foreign Physicians Conference.
Yes.
Huh. Let's not wait for the elevator. It doesn't work for me. We'll take the stairs.
Unbelievable.
If only she would ask for political asylum.